And hi, and welcome to our session for this evening. It's titled Multilingual Tools for the Evidence-Based Practitioner, and essentially, as kind of the name refers to, is that we're going to be covering a variety of different resources and other types of tools that are available to clinicians and to practitioners in working with patients who have a diversity of different language backgrounds. So really this is a really good way of building your own cultural competence skills and also just reflecting on our own positionality in terms of being for many practitioners and clinicians in the United States being predominantly English speaking like natives in that sense. And but with our increasingly diverse populations, we're going to be facing a lot of patients and interacting with them on a daily basis. And they may not necessarily be fluent in English, and that can really pose some interesting dynamics when it comes to the actual interaction. When it comes to examination of the patient, the physical examination, history taking even as well, patient education could be another issue that pops up in terms of being able to inform your patient about not only the diagnosis, but also about information regarding their condition or treatment options that are available and what will be potentially be pursued in the course of their own treatments as well as their own outcomes as a patient. And so really this session is really designed to kind of cover those, provide almost a walkthrough of sorts, and we'll be kind of covering a variety of different high quality multilingual tools, because I'm sure with most of us, when we try to translate something, we often maybe resort to Google Translate. And if you've ever used that in any capacity, you might notice that it tends to have certain errors, shall we say, when it comes to providing an accurate translation of something in Spanish or Cantonese or any other language. And so for these particular tools, we're wanting to step beyond just Google Translate and more of those convenient internet search engine type of tools and really delve into quality tools that are specifically designed for clinicians and practitioners, because we also need to regard that a lot of clinical work deals with jargon. And how do we simplify that type of jargon for our patients as well? So that's another thing to consider. So these tools will hopefully help out in that regard. They're by no means perfect, but they will definitely provide an alternative beyond getting interpreter services, which are definitely important and definitely ideal. But in some cases, you might need to refer to yourself and your own array of tools on your tool belt, as we say. So yeah, let's go forward with this. And again, also just to clarify is that you can unmute yourself at any point if you want to clarify something or ask a question. I'm always happy to do more of a conversational approach to this, even though I might be doing a little bit more of a lecture-based kind of walkthrough here, but I'm always happy to do some conversation or discussion. And then, or you can also feel free to input anything into the chat as well. Be sure to keep a watch for that as well. But yeah, let's begin. But essentially, MedlinePlus is a really high quality resource that's been hosted and created and developed through the United States National Library of Medicine. It's a very robust, let's say a health encyclopedia that works for both health providers, practitioners, clinicians, as well as being a resource for consumer health and namely patient education. And you can do a further exploration about its variety of other resources here about like health topics and all the information it provides there, which again is also very high quality in the resources that they draw from. Namely, they draw from the scholarly literature and do a little bit of their own critical appraisal process in determining which studies and other types of literature to use to inform about different health topics. They also have encyclopedic information about drugs and other supplements and medical tests even, and a whole host of other resources that I definitely encourage that you should check out. But for our purposes here, since we're really talking about language and being able to interact with patients across different types of namely languages. And yeah, and so what they have here on MedlinePlus, even though predominantly the information here is provided in English, they do have a number of information handouts and other types of materials that you can readily give to your patient or use as you interact with your patient in different languages. So say we were interested in doing Hindi. Maybe we were interacting with a patient who speaks primarily Hindi. You can actually look into the health information provided here, and they actually have some brochures and other types of handouts and materials provided on different topics like abortion, acute bronchitis, surgery, like home care afterwards. Especially for like total joint replacements. So if you're like a physical therapist working with that, that might be an excellent way of doing so. Alzheimer's disease, if you're working with anything regarding like neurocognitive disorders and so on. So you can have all these, a whole range of different information materials, and it's even in bilingual too, so you can actually work with your patient and talk with them and be able to, like, even if you don't understand Hindi yourself, you can actually refer to how it's being translated, and that way they can read here and you can read in the English portion if that's your preferred language. And that way you can have that more seamless communication, and rather than trying to guess what exactly is being spoken in Hindi, you can actually see. And yeah, and again, these are high quality, very reliable translations that they use here and that they provide. So I definitely recommend checking it out. On another end of here as well, is when it comes to Spanish. So Spanish speaking populations are a very predominant population within the United States, namely, right? So even though they provide a lot of information here for a variety of different languages, and as well as Spanish, what you will find actually when you go on to Medline here is that they actually have an Espanol version. And basically the entire website is translated into Spanish as well. So if you're working with Spanish-speaking patients, you can provide this. Does it have Navajo? Let's check here. I know there's some like indigenous languages that are used and applied. Let's see. I don't see here in this case. Let's see. But that's actually a really good question. Another, what I would probably refer to if you're actually looking for those type of resources, I know a lot of tribal nations typically provide resources or try to refer as well and have their own like services. So yeah, if you're needing to look into that, I definitely would recommend that. Yeah, the entire website is translated into Spanish, and you can easily access all of the different resources here in Spanish. And that also includes your patients. And yeah, and that's one thing to really emphasize here is that MedlinePlus not only works as a practitioner resource, it definitely works as a patient resource. Yeah, and you know, which is such an important thing, because a lot of times when when even we might look into information about our own health conditions and we're just doing a general Google search, it can be hard to parcel out which ones are the more reliable websites. Unless we have like our, you know, education or experience, especially like as an emerging clinician yourself, or as librarian, like me, I might be able to parcel that out, but maybe for other people in just general society, they may not necessarily be able to rely on it. And more importantly, be able to rely on a highly high quality resource that is translated into a different language other than English. So, which makes it even more of a challenge for those patients, right? So yeah, I definitely recommend checking it out. Yeah, exactly. Helpful for translator services. Yeah, definitely. And like I said, this is kind of like a really useful tool in the case that you may not be able to have a translator on hand for whatever reason at your place of work. Even though, that, again, that is the ideal to have a translator who can provide that kind of communication, but there might be times when it might be necessary to depend on these type of resources. Another one I want to highlight here is the Health Information Translations website here. I'll provide it in the chat also for your perusal as well. And basically it kind of works in similar regards to MedlinePlus, but there are a couple differences, namely being that it's not developed through the United States National Library of Medicine, but sponsored through a whole host of like Ohio-centric type of organizations and universities, but the information that you can find here in terms of translations can be readily applied beyond just Ohio. It's just, that's where the resource originated, right? But yeah, you can search by health topic, so you can find about like, let's say, diseases and conditions. And we can look in a whole host of all these different conditions here. So let's say we were interested in, say, like heart attacks, just for our purposes here. You can find a bunch of different materials translated into these different language materials. So say I was interested in maybe Somali. You can find all this information provided in Somali, or at least the native language of Somali for heart attacks. And again, kind of like similar to the MedlinePlus, you get to see this kind of like comparison, so you can actually work with your patient with this material and be able to actually talk about it rather than having to try to figure out what is being spoken here. You can immediately see that direct translation here in English. You can also search by language, so you can immediately see there's a whole host of different languages offered here. Some of them overlap with MedlinePlus, but there are a few differences that you probably will see, and different materials also offered as well. So it's a really great resource in that case. And you can even search by keywords, but honestly, probably searching by language or searching by health topic will probably be the easiest. Yeah, and then even for like diagnostic tests, you can see like translated information for different types of tests. So like for bone scans or for EEGs as well, you can readily access these. And let's see about doing it in Japanese, for example. And yeah, again, you get to see about like, you know, home care, what you should do to prepare for a certain type of test or surgery or some type of other intervention, and even home care afterwards. So it's a really nice way of being able to provide that type of patient care in your communication to them. And yeah, and I think it will definitely help to build that trust you have with your patient, because the fact that you're even going the extra step of actually providing these type of materials and really thinking about those type of inequities that they might face, those barriers they face because of language differences, especially accessing healthcare services and systems. Yeah, exactly. It's information patients do not need to remember because they can read it later. Yeah, it's something you can readily print out and provide to them, and like they can use it for themselves to educate themselves further. Because maybe, yeah, especially I'm sure with a lot of patients, they might be experiencing anxiety. So, you know, understandably, like anyone's memory might be like kind of like short term in the sense of like, you know, listening to your practitioner as they explain something, but you're still having to grapple with like maybe about the diagnosis or what the treatment's gonna have, or yeah, family members as well, because maybe they're trying to process everything. So you can immediately share that with your family members, especially if they have to take you to your surgery or your test or anything like that, so they can be aware of what's happening. Yeah, definitely. So yeah, it's a really great resource in that sense. And a lot of these kind of function in that same vein and purpose. Another one I really like to talk about too is EthnoMed. So let me bring it up here really quick. I do see a comment. These valuable info in the COVID times where only one person is allowed. Yeah, that is a totally true case actually. Yeah, because like maybe a family member wanted to join in so they can listen in and be supportive and, help with the home care or anything else that might be necessary for, future treatments and options and other types of tests and diagnoses that they might have to go through. And yeah, the fact that like with COVID, it has limited the ability for, those consultations to be only with the patient themselves. And yeah, and it's an excellent way of being able to provide a handout or materials that you covered with the patient, but they can also talk with their family members or friends or whoever they depend on in their own care. Exactly. So yeah, and then to continue with EthnoMed, I think I provided in the chat already, but essentially this is a resource that was originally developed in Seattle and specifically more for Seattle, but it has grown, over the years to include, healthcare providers and practitioners with resources that they can readily use beyond Seattle and the greater area of that. And particularly, it's a great way of incorporating, as the title here says, cultural information into your clinical practice. So namely, this website is really dedicated to giving you a better cultural insight into your patients, whether it comes to, how to greet them or, just general etiquette that you would have in your communication and so on. And so you find a variety of different clinical topics that are discussed here: cardiovascular, cancer, infectious disease, mental health. So say we were interested in that, you'd be able to find resources not only for providers that would be definitely of interest, such as videos that are also translated, or cultural profiles that you might be interested in, but also for patients as well. So for their own patient education, like booklets, presentations, and so on, that might be relevant within understanding depression. So, so yeah, and it provides like these really real stories. Like even this one in particular has like a 2-page story of a Vietnamese woman dealing with depression. So, and it's translated in both Vietnamese and English, so you can easily talk with your patient about something, being able to relate to them and talk about it. And talk about this particular case and like how family can help, as we've kind of discussed a little bit. But yeah, and you can readily find these, can readily use these. There's also a list of different cultures that you might be more, like if you are working with a predominant culture in your community, you can totally focus on that, whether it's like Latino, Hmong, or Iraqi, Somali, anything like that, even religion too. But in our case, for example, with Vietnamese, say we were interested in talking about Vietnamese, you can actually look at information about their cultural profile, language, and talking about that, like, the diversity of different languages or any differences that might be with dialects and such. And if we even scroll down about interpersonal relationships that you might have with them, greetings, etiquette, again, displays of respect that you might want to communicate. Because again, even with language, we're like, I've been mainly talking about verbal language, but what about body language and the cultural differences that kind of happen with that too? So being able to note that when you do like maybe a home visit or with a patient, or even just in the clinical setting, it might be something to consider. But yeah, so there's also a whole host of different translated materials as well that are both in video content as well as written materials on different types of subjects when it comes to like traditional medicines, diabetes, if we were being more specific. But yeah, and it'll tell you like what exactly these languages are translated in, like Khmer, which is like for Cambodian, particularly Somali, Spanish, Vietnamese, and be able to access those. I did see a question. Decreases communication gaps. Yeah, totally agree. I mean, that's kind of like the purpose for that, and be able to kind of reach to your patient in such a way that kind of reflects their own culture, their own language. So it really kind of emphasizes their humanity in a way, like rather than just being a patient that you're having to deal with, but it really gives that impression, right, that you're going that extra step to meet them as a person. Yeah, so I also see the question, are they copywritten? Can all always use them? Yeah, for the most part, these are all provided to clinicians and to practitioners. It's definitely something to encourage fellow students, educators, and even fellow clinicians and so on to use. And this is just really one way that people have been trying to support better healthcare, more culturally competent and more culturally responsive type of healthcare for patients. But yeah, so these are kind of like the three main resources that I really kind of wanted to highlight. Another thing to just kind of note, just as a quick aside as well, one of the things I recently discovered is the utility of using visible body. If you might be familiar, it's the 3D software that the library provides access to for students, staff, and faculty to use. And actually, there is almost this clinical application that you can use with visible body beyond just your own reference and learning about different pathologies and different parts of the body. But let me bring that up really quick, and I'll kind of explain how this kind of relates. So on Visible Body, which you can either download onto your phone as a mobile app, there's like 3 apps in particular that you can download for Visible Body. All have like different types of functions. But for our general purposes here, I'm just referring to the Human Anatomy Atlas app of Visible Body. And if you're probably familiar with it, you can, again, also use it in a browser or your laptop. But yeah, let's say like I was interested in pulmonary, and maybe I was working with a patient in regards to that. And I was trying to figure out a way of like communicating like how a certain diagnosis worked, or, the overall condition that the patient was experiencing, and kind of really demonstrating what was happening inside their body. For one, it provides a really great visual about what's happening in the body. You can directly refer to different pieces here. So say I was actually interested in like maybe this part of the body, and you can get a full definition about it, about this particular part of the body, or more specifically here is pathologies. And you can talk about anything that might be in regards to, say the patient was experiencing something to do with maybe heart attacks, or maybe it was at risk of them, and really trying to help them out with that. And you can provide some more information about this. And actually, a lot of the information provided is through MedlinePlus. So that kind of just tells you the quality that MedlinePlus has in terms of the information it provides. Is that Visible Body depends a lot on the definitions and the summaries and the critical appraisal of the literature from Medline to inform the app itself. And so one of the things is, you might have noticed, is that it's by default presented in English, but there is a way to change the language into Spanish or some other language in the settings here. So if I was actually interested in changing the language to, it's understandably a little bit more limited than what we probably saw with MedlinePlus and so on, but say you were working with patients who are predominantly like Spanish speaking or Japanese speaking, or even Chinese as well. You could refer to Espanol and then update that, and it will automatically translate all the information here into Spanish. And that way you can immediately refer to this information. They can actually refer to it as well. Kind of just walking through them. They may not be able to take it home with them, but in the clinic or when you're working with them in the field or doing an internship, you can immediately kind of like, hey, let's kind of go over this together. Yeah, like you said, it's a nice feature, right? And it's a great way of kind of like talking with them. Audio, that is a really interesting question. I don't see anything here in audio, But that'd be a really cool feature. If that ever does come out, or maybe it's something we can ask our service provider for visible body and see if that's something they could put in the works, like kind of like recommend that, because I think that would be definitely key. An audio button, exactly right. So yeah, I think that would be probably the next step to really making it much more accessible in that way, especially for anyone who's visually impaired. That would be something to consider as well. Any patients or even the practitioner themselves, right, might be visually impaired. So yeah, no, that's a totally great question. And I think that's where like EthnoMed comes into, like, because it provides more like audio visual or more emphasis on the audio part of it. The fact that they also provide those type of translations in audio is pretty nice in that sense too. So for sure. And hopefully also like maybe you can also use it through like text to speech as well. Maybe copy and paste it into a text to speech app of some sort and be able to kind of sound it out there as well. That might be like kind of a quick workaround. That's another way of kind of going about that. And that was something I just kind of recently thought about, of how we can creatively use these type of software to really enhance our communication with patients. And again, also to enhance that cultural responsiveness and really kind of be more inventive and innovative with the ways we do that. But yeah, in that case, that pretty much kind of ends my spiel here. At least for this particular one, or maybe put the pic into iMovie. Yeah, that could be another option as well. With visible body, it might be something to take care of with like copyright type of issues. That probably would be an example of that actually happening, especially with the visuals here. But there are plenty of other resources out there that actually provide like these type of anatomical illustrations and imagery. So you could probably use those instead, depending on like copyright usage. And oftentimes they might be in like Creative Commons licensing, where all you have to do is just attribute them in whatever resource you're creating. But yeah, that just might be something to consider. And again, you can always refer to your librarian for some consultation on that regard if you ever have any questions about how you can maybe create a resource that incorporates that. But no, I think that's a really creative way that you're suggesting. Yeah, and there's plenty of other types of resources. These are more specifically more geared towards multilingual. I hopefully have in the works to do more in just health equity in general when it comes to like Black, Indigenous, and people of color resources. So like when you're talking about like Navajo or Dene, you know, I have a couple of resources that kind of go in that line, but not necessarily multilingual aspect, but just in terms of research and clinical practice. But those will probably be future events that I might look into hosting, especially because I think these are really important resources to kind of highlight because people may not be readily aware or just maybe just need a refresher, right? But yeah, and yeah, I hope you have a great rest of your evening, depending on your time zone and such. But if you have any questions, feel free to unmute yourself or put yourself in the chat. But yeah, thank you.